Alright, guys. So we have spoken a lot about inborn errors of amino acid, this okay, and urea cycle disorders and all of that. All right. So here we are just trying to look at the summary, where we try to look at all the disease conditions just in a single lecture. So for the summary, of course, you know that all the what do they call it? Metabolic issues. All right, all the metabolic issues, they are usually due to an enzyme missing. All right, in the whole pathway and all of that. So we have how we'll be doing it. We'll talk about the substance that is affected. All right, then we'll talk about how the condition actually presents, how it presents. We'll talk about the enzyme that is defective. We'll talk about the clinical findings. Then we'll talk about the inheritance pattern. All right, so the AR you see there is what? Autosomal recessive. Autosomal recessive. If you go to autosomal dominant, you should see what? AD. So for phenylalanine, you can have phenylketonuria, type 1, type 2, type 3. The enzyme that is defective there is what? Phenylalanine hydroxylase. Alright, that's in type 1. Then the dihydropterine reductase in type 2. Okay. So clinical presentation is just mostly mental retardation, microcephaly, they said pigmented skin, eczema, mousy odor. Then for the tyrosine now, tyrosine we said that what? It's also known as what? Tyrosinemia. That's hepatorenal type 1. Alright. So for the tyrosine, we have things like what? Okay, we have the type 1. That's a hepatorenal. Then the type 2 is the oculocutaneous, right? Then the type 3. So for the type 1, the enzyme missing is what? Of course, anything I'm saying here, you can basically just get the pathway for it. Let me say just go search pathway for tyrosine metabolism and you can follow me up. Or if you have read it before, this would be a good summary for you. Type 1 is what? Fumarate acetoacetate hydroxylase. Then type 2 is what? Tyrosine transaminase. Type 3 is what? 4-hydroxy phenylpyruvate deoxygenase. So the clinical presentation is basically usually the same thing. So there's liver failure, there's liver cirrhosis, there's rickets, there's failure to thrive, there's peripheral neuropathy. Okay. Then palmoplantar keratose, painful corn erosions, plotoblobis, mental retardation, normal liver failure. Occasionally, you have mental delays coming up. Then for the homogentisate acid, we have things like what? Alkaptonuria. All right, Alkaptonuria. So it's a homogentisate or acid oxidase that is missing. So there's ochronosis. I think that's the position of what? Homogentisate acid in the skin. All right, the position in the joint can actually cause arthritis. All right, cardiac valve. This is not value. This is valve, right? Then inevident coronary artery calcification. So all of them here, the inheritance patterns is basically what? AR. That's autosomal recessive. The disorders of DOPA is albumin. All right, where what? The enzyme defect is tyrosinase. So the here they try to describe tyrosinase for a while. They said that if it is there at all, you should be able to convert what? The hydroxyphenylalanine to melanin. Alright. So there's hypopigmentation on the hair, there's visual loss, rigidity, truncal hypotonia, tremors, mental retardations. Therefore GABA now, 4-hydroxy was butyric aciduria. Okay, or the succinic semi-aldehyde dehydrogenase, right? So that's a enzyme that is defective. Then basically you can have seizures, mental retardation, ataxia is coming up. Then for tryptophan, you have the tryptophanuria. Our enzyme is unknown. Clinical presentation, you can basically have what? Mental retardation, ataxia, skin photosensitivity. Alright. So for histidine, you can have what? Histidinemia. So the enzyme that is what? The enzyme that is deficient there is what? Histidine ammonialase. Right. So going to the urea cycle right now. So for the urea cycle, we have it like this. Okay, no. Sorry, we are still on the amino acid, okay, deficiencies. I think these four, then urea cycle actually starts down, you know. So for glycine, you can have glycine encephalopathy, alright. Okay, no, the first one is what? Forminoglutamic acid, alright. So the condition is known as what? Forminoglutamic aciduria. The deficient enzyme is formimino what? Transferase. Then sometimes mental retardations could come up. Glycine encephalopathy, the enzyme is not really known. Then there's infantile seizures. That's like how would I call it? That's a clinical presentation. There's lethargy, there's apnea, there's profound what? Mental retardation. There's some typing errors here. Then for serine deficiencies, the condition is known as what? Phosphoglycerate what? Dihydropeneas. Enzyme deficiency is phosphoglycerate what? Dehydrogenase. You have seizures, you have microcephaly, mental retardations coming up. Then for homocysteine, condition is known as homocystinuria. You are losing a lot of homocysteine in urine. So that the enzyme absence is known as what? Cystathionine B synthase. So you have lens dislocation, thrombotic vascular disease, mental retardation, and osteoporosis. Then cystinosis, we have the renal Fanconi syndrome, rickets, photophobia, hypotonia, renal failure. Okay. So for the urea cycle ones, you can have what? Deficiencies of what? Carbamoyl phosphate. The enzyme deficient there is what? Carbamoyl phosphate synthase 1. There's lethargy, progresses to coma, mental retardation, hyperammonemia, ornithines. So there's gyrate atrophy of choroid and what? Retina. Enzyme deficient is the ornithine delta amino transferase. So there's myopia, night blindness, loss of peripheral vision, cataracts, you know. Then also still the ornithine, there can be deficiency of another enzyme known as what? Ornithine transcarbamylase. This one there's lethargy and mental retardation. Then citrulline, also known as citrullinemia type 1. There's what? Arginosuccinate synthase deficiency. Can lead to what? Coma. Alright. The arginosuccinate, there's a condition known as what? Arginosuccinic acidemia. This one there's deficiencies in what? Arginosuccinate lyase. So lastly, we are talking about deficiencies of all these important amino acids: valine, leucine, isoleucine. So for these ones, Syrup Urine Disease, that's MSUD. So there's branch chain what? Keto acid what? I think dehydrogenase deficiency. So there's lethargy, encephalopathy, maple syrup odor in the urine, okay, and there's also protein intolerance.